Good morning. Thank you for having me with you today.
Bonjour, docteur. Bonjour.
Bonjour. Comment ça va?
Ça va très bien, merci.
Okay, that's about, my French is about there.
That's it. So mine's bonjour, yours was, I have no idea what that was.
But yes, Doc, can you actually clarify
Mine
to
too,
us?
don't worry.
So Doc, can you actually clarify to us what is osteopathy?
Okay, so basically osteopathy is a manual practice which is, as you said rightly, closely related to chiropractor, Tita, for example, as we know in Malaysia, or all kinds of bone setting manual therapies around the world.
Right.
The fundamental difference is simply that chiro, they mostly concentrate on the spine. Osteopathy, we look at it from a very global perspective, and we treat every single structures of the body, whether it's the foot, whether it's an organ, whether it's the skull, the different bones of the skull, the different tissues, etc., etc. So we can manipulate everything. We basically, for us, the body is a machine which has all its structures interconnected and interdependent. So if there is one structure that is off balance from a mechanical point of view or movement point of view, it might disrupt the rest of the system as well. I usually take that example of a Swiss watch, for example. You have hundreds of pieces constituting that watch. If one of the piece is not properly functional, doesn't have the right shape, or doesn't have the right movement, then it will have an impact on other structures around and eventually the whole watch itself.
Right. So, doctor, you can see us right now, we can see you, right? The first question I want to ask you, how's our posture? Is it okay? If you could tell.
It's
it's okay, doctor. I was just pulling a
well.
Yeah.
Yeah,
But
the first thing Brandon did before he asked that question, see how he's sitting like this? Immediately he stood up straight to ask before asking you that question. I see what you did there.
But doctor, I just like the idea how you compare. Yeah, how you compare the human body is like a mechanical parts or elements, right? And how if it's off balance and it would affect other things. So osteopathy is more than just your structure, your posture, your muscle. It's more than that.
It's everything. I made it very simple to explain, but basically we have two elements in the body. So one is the machine. It's a biological machine, in fact. So the machine means that our body is falling under the rules of mechanics and physics. Okay, so like a car. If the different structures are moving properly, are shaped properly, then when you engage the movement of these structures, it will respect the function that is meant for. The second aspect is the biological structure. So the difference between your car or a computer and our body is that the life, it's the signature of life is the fact that your system has the ability to repair on its own. That's the difference between a car and our body. So in osteopathy, we will use techniques which you can correlate with certain techniques in Chinese medicine, for example, which will facilitate the vital system and help the body to heal on its own in a better way. So basically, you have the machine. It has to be as balanced as possible, and you have to have the vital system, which has to be strong as well to ensure that that system, that machine works at best.
Right. Wow. Oh, that sounds very interesting.
I sound like it sounded like my body is all spoiled already.
No, it's not. But actually, so you mentioned earlier that chiropractic, it's more on the spine, right? Focuses on the spine, whereas osteo, it's I would say it's holistic. It's your entire body. I actually want to know, what is the treatment, or what are some of the treatments that you use during consulting your clients, your patients, yeah.
And well, there's treatments involved, whether it's just machine, or maybe it's just your fingers correcting the posture or the muscle, or maybe massages, any of that sorts.
So, exactly. So, to start with, our practice is only manual. So we have a diagnostic tool, which is our hands, which we train to feel the different imbalances. Imbalances means, for example, you take a vertebra.
Yeah.
This vertebra is supposed to move in all directions of space, okay, to be free. If there is a change in the ability of that particular vertebra to move, then that might be the sign that there's an imbalance underneath. But we don't look at just the vertebra. We connect the whole system together. So we will find the different tensions within the system, and we are educated on my side. At my time, the studies were 6 years. So we learn the fundamentals of anatomy, physiology, etc. So we have a technical knowledge, which we combine to the sensory experiences of touching people and defining what is balance or what is not balance. And over time, you build a database of sensory information telling you if the patient is balanced or not, if that area is working well or not, and then that's how you treat people. So basically, it's manipulation. You've seen with chiropractors, or basically we are what people call cracking. It's one of the techniques that we use, but we have other techniques which are softer techniques, which we call tisular techniques. So we combine a lot of techniques, but it's purely manual.
Okay. Now, it's quite cool, Zoe, that you mentioned treatment, right? Whether what are the treatments involved? And doctor, you just mentioned that you use your hands, your fingers, your hands, which is more. Would we say, or could we say that it's more better as compared to machine? Because I've heard about some places they use machine to actually detect that you have an issue with your body. But this, when you just mentioned that they actually use your fingers to detect the instability of your body. So would you say that hand is actually better than machine in this sense?
It's a very debatable question in many aspects. When it comes to mechanical issues, I still believe that the best way is to test the body with your hands, because it's the best tool you have, which allows you to detect when your hand is trained properly. It provides you a lot of elements, and there is a very important component beyond the hand, is the fact that your hand is connected to your brain. So it means that you have a certain knowledge that you apply to your hand. There is an instinctive understanding of certain things. There is a technical knowledge, which the machine doesn't provide, because the machine doesn't see the movement, doesn't perceive certain very small tensions, etc. You will get an image, and then you have to interpret that image. How accurate it is? Not necessarily always perfect. And in that case, the hand is a good tool.
Yeah, no, I understand where you're coming from as well, because the typically machines are used to check our insides, right? It's things that we can't see. Whereas the hand, when you use, I imagine that if you use your hands, let's say you're touching my arm and I feel immediate pain, I can tell you immediately, versus a machine and so on and so forth. I actually want to know now, does osteopathic treatment, is it used for rehab purposes as well? And how is it different from physios?
Okay, so that's a good question. Actually, if I take another example that I give to my patients, it's basically if you come to my shop with your bicycle, and your bicycle has a twisted wheel. My job is to realign that wheel. If you go to the physio will just ensure that this wheel is moving properly before you go on the road.
Right.
But if you don't realign the wheel, it doesn't make sense to rehab the wheel, to train the wheel to move. So our work is complementary with physios. Is we're going to work on the structure, on the mechanic. We ensure that the whole system is perfectly or as perfect as it can be functional. And then the physio will train the structure to move and to what we call proprioception, which is basically reinforming the brain how to perceive how the different structures are moving and reconnecting it. And then you can go on the road with your bicycle.
Right. So, Doc, we're talking about structural balance right here also, right? We're moving into that particular topic. Structural balance, is it just body posture, or it could be like, it could be any other thing besides your muscle and your body posture. It could be how you take care of your insides, like probably your heart or your organs or any of that sorts.
So, to explain the position we have as a holistic position as osteopaths, we take care of the machine from a mechanical and a vital system point of view. Okay, so the disruptions of the machine are always due to trauma.
Right.
So the first trauma we might face in life, it's birth.
Right.
How traumatic was your birth? Forceps, vacuum, short birth, long birth, C-section, etc. will determine your balance for the rest of your life. If you don't change what the trauma has done at this stage, you will grow around these imbalances. The other trauma is surgery, accidents, fracture, whiplash, car accident, etc. So this might disturb the machine, the balance of the machine from a mechanical point of view, movement point of view.
Okay.
Then there is another aspect is, one is the machine, one is what you put in the machine, and how do you take care of that machine, okay, from a psychological or spiritual point of view, etc., etc. So I always give that example. I'm going to give you many examples. So having a Ferrari, but you put bad oil inside, your Ferrari is going to go quickly off. Okay. But if you have, you can have a car which is not working properly. You can put caviar inside. It's not going to work. Okay. So your Ferrari has to come with the good fuel. The good fuel is what you eat. Okay. So that will have a big impact on your health. And then your mental health, and this will determine also a lot of the issues you will have in life, how you apprehend life, and how you go through life.
Now you see, my mom is going to tell me, see, Brendan, I told you, you are what you eat.
Yeah, exactly.
You just mentioned that, doctor.
So I want to know, Doc, is this treatment suitable for people of all ages, or is it specifically, do people go see you when they're adults, when they're,
when they are having that pain, or specific age group? Is it open to all, no matter how young or how aged you are?
Exactly. So there's no distinction in that sense that anyone can have a mechanical issue. And in fact, most of the issues that we face in life are mechanical.
Right.
Unless you have an important disease like a cancer, a fracture, or something like this, this will bring you in a different category.
Okay.
But most of the aches and pains that you have, they are linked to mechanical issues. So we see, I am personally mostly specialized in kids, pregnancy and immune system conditions. So half of my patients are newborn and kids, because this is what I'm really interested in. And that's where you can really make a change in their life. Because, for example, we see young babies, a few days old or a few weeks old, with a difficult birth, like they had vacuum or forceps, the skull is deformed. And if you don't change the structure, if you don't intervene at that time to reverse the mechanical constraints that were imposed on that skull, the skull will grow around it like a little sprout coming out from the ground, blocked by a rock, will grow bended, and you come in 20 years, the trunk will be big and bended. If you take off the rock at the stage of a sprout and you put a little support, then it will grow back straight. These are simple, natural rules, again, based on physics and mechanics. And this is why it's so important for me to intervene with kids, but we see old people as well. There's a lot of work to do for everyone who needs it.
Right. That's actually so interesting. So very quickly, Doctor, can you tell us what are some of the movements or some of the things that we should watch out for, especially during this pandemic where we're not doing a lot of movements, we're not going out, we're not even able to really go outside and exercise anymore. What are some of your tips on maintaining good structural balance?
That's another good question, and actually we see a lot of patients coming back to us with many issues simply due to the fact that they sit constantly, they don't move at all. So one of the fundamental advices that I give is do yoga. Yoga is it's a great system that has been developed over thousands of years.
Right.
And it's a great basis to ensure that your system moves and is properly organized.
Right.
The other part that we see in that pandemic is the psychological burden that people are going through, and it will definitely affect the body as well, because you're not in a good
mental state of mind, right?
State. There are lots of components, and again, they're all linked. You tend to eat bad, you sit too long, you don't move, you don't see the light. Basically, it's a perfect set to become very unhealthy very fast.
Okay.
All right. Sounds very, very interesting.
So do yoga. You are what you eat, and just go out and get some sunlight. Most importantly, just move around.
Exactly.
Thank you so much, Dr. Nicholas, for joining us
and
right
think
here.
Positively.
Yes, I think I love the conclusion that we have on the show today. It's like take care well, do yoga. Honestly, yoga, my favorite pose and doing yoga is child's pose.